We continue Chapter 20, Musculoskeletal Injuries, in this podcast by looking at the types of splints you can use to immobilize a musculoskeletal injury. Splints are some kind of a mechanical device that's going to prevent an injury from moving. We've got four main types: soft splints, rigid splints, traction splints, and improvised. The classic soft splint is a sling and a swath. If we take two triangular bandages, this is the go-to for any upper extremity injury, from the clavicle all the way to the wrist. We see it in the photo here. The sling wraps around the neck and supports the lower arm, while the swath holds the upper arm close to the body. Right here, we have a ball and socket joint that can move in 3 dimensions, so we have to immobilize it in 3 dimensions. Other soft splints might be what we see here, a vacuum splint, which is filled with a movable material, little styrofoam balls like you would see in a beanbag chair. And by pulling the air out of that space, it becomes rigid after that vacuum evacuation. You can use a blanket roll. We also have specialized soft splints, such as we use for an unstable pelvis, a pelvic binder. Now, a rigid splint can be as simple as a padded board that we see here to isolate an elbow injury. Additionally, we can use a cardboard splint, or we have some rigid metal splints. They're kind of old school ladder splints or wire mesh. They're reliable, they're low cost, and they're pretty easily acquired. Here's an example of a commercial cardboard splint. By forming cardboard into this channel shape, it becomes stronger and more rigid and becomes a very cost-effective way to isolate a knee or a lower leg injury, such as we see these patrollers working. Wood splints are going to be a little bit more rigid, and so we might consider those for injuries to some of the longer bones in the body. Now, quick splint, such as we see here, is classic ski patrol response. For lower extremity injuries, we see that this is essentially a clamshell of 2 rigid boards with foam inside for patient comfort, and so to not compromise CMS. You can imagine opening this up like an open book, placing the patient's leg inside, clamshelling it around the patient and strapping it in place, and very securely immobilizing an injury to a lower extremity. If you have a fractured femur, this is the longest bone in the body, and it is surrounded by some of our stronger muscles. A traction splint is appropriate because it will pull the limb into an anatomically neutral position and work against those large muscles of the thigh, preventing further soft tissue damage. Now, that alignment is also going to alleviate some of the patient's pain. There are several different types, and each ski patrol might have a different type or perhaps 2 types available on their hill. The Sager splint actually works on the inside of the thigh with an ankle hitch against which traction is pulled. A Slishman splint is what we see here, and a Kendrick splint is a very common type of a traction splint. They're very low cost, very effective. Traction splints typically only for a mid-shaft femur fracture. Now, we can contrast traction versus tension. Tension is a lesser amount of force applied to realign that bone into its anatomic position. See the contrast here. For a mid-shaft femur fracture, about 15 pounds of force, or 10% of the total body weight. Only about half of that for realigning other long bones that may not be anatomically correct. Traction splints are going to be contraindicated That means not recommended for anything that's very, very close to the knee, the distal third of the femur, or an upper extremity fracture. That's a brief overview of the type of splints. As we manage particular injuries, you'll see their application in more detail.